This third paper uh, in third set of in vitro information comes from my in vitro data on intestinal epithelial cells when subjected to oxidative stress. The tunnel technique as well as the flow cytometric analysis in the subsequent slide both show that ghrelin has potent anti-apoptotic properties, and these anti-apoptotic properties are antagonizable with growth hormone secretagogue receptor antagonists, that is D-lyth3-GHRP6. What we noted in this experimental series was that ghrelin inhibits the release of cytochrome-c from mitochondrial membrane and thus inhibits the caspase-3 activation and finally prevents the apoptosis in intestinal epithelial cells. So here are left with a bunch of important conclusions to be assessed in an in vivo setting. First, ghrelin mediates intestinal cell proliferation through a new subset of growth hormone secretagogue receptor. The effect is acylation and growth hormone IGF-X is independent, and ghrelin can prevent apoptosis when subjected to inflammatory or oxidative stress. In the in vivo setting that we will be using, we don't have enough experimental procedures which have been done to validify each and every of these in vitro data conclusions, but I hope that the experimentation that we have done in our forthcoming experimentation design would be very helpful in clarifying our in vitro data. Our aim now was to see the effect of ghrelin on normal intestinal mucosal turnover of the cells. For which we actually injected rats with parenterally with the ghrelin 50 microgram per kg body weight, and for 7 days, twice daily, and then finally we analyzed the effect of ghrelin on intestinal mucosa. We analyzed the effect of ghrelin on intestinal mucosa through BRDU staining, tunnel staining, histological parameters, and we repeated these experiments in hypophysectomized rats, subsequently to see whether in hypophysectomized rats ghrelin could account for any hypertrophy of intestinal mucosa. Ghrelin is expressed in villus compartment as well as in the crypt depth. On the contrary, growth hormone secretagogue receptor 1A is only expressed in muscle layer. Growth hormone secretagogue receptor 1B, however, is globally present. But don't we know it? It is inactive. Ghrelin treatment increases the intestinal mucosal weight by increasing the protein content as shown in these graphs. These effects can be antagonized with D-lyth3-GHRP6. Here's the analysis of intestinal mucosal height, which again shows that ghrelin has potent effect on intestinal mucosa. It increases the villus height as well as crypt depth, as you would adequately appreciate that ghrelin is effective in augmenting intestinal mucosal compartment. Here is the picture which more clearly shows the comparative increase in the mucosal absorptive area. Ghrelin augments the mucosal absorptive area by increasing the intestinal mucosal height, and these effects are antagonizable with D-lyth3-GHRP6. Here is the review of the proliferation index, which significantly increases following ghrelin treatment. Apoptotic index also reduces with ghrelin treatment, and antagonist reverses ghrelin mediated effects. Finally, as we know that ghrelin-mediated effects on intestinal mucosa may be a function of concomitant growth hormone release, we thought it might be prudent to study whether this effect is growth hormone IGF independent or dependent. The animals, hypophysectomized animal was used. They were obtained from Taconic laboratories and were confirmed for hypophysectomy was confirmed with growth hormone IGF-1 levels. Ghrelin does the same as we described before. It increases the intestinal mucosal absorptive area even in the hypophysectomized animals. I think this picture alone describes the whole story. Ghrelin has significant effect on intestinal mucosal absorptive area. It increases the intestinal mucosal absorptive area by increasing the villus height, creep depth, and protein content. So here are the few conclusions which we draw from this in vivo data. Ghrelin has potent pro-proliferative and anti-apoptotic effects in intestinal epithelial cells at in vitro and in vivo level. Ghrelin's role on intestinal epithelial cell proliferation and apoptosis is as acylation and growth hormone IGF-1 axis independent. Ghrelin's effect may be mediated through a new subset of growth hormone secretagogue receptor instead of known receptor subtypes. Role of ghrelin in massive intestinal resection, stress, inflammatory sepsis related still needs further scrutiny. Role of ghrelin in intestinal tissue inflammation, ischemia, reperfusion injury, and sepsis needs further evaluation. And finally, we already know that from Wu et al. Studies that ghrelin has potent effects in intestinal inflammation and ischemia reperfusion. So should not we now be using as a in phase 1 trials to see whether ghrelin has some potent anti-inflammatory effects on in humans? And secondly, we need to see whether it can improve the survival in critically ill patients with mucosal barrier dysfunction. So what we expect from this data as well as from the previous literature, that ghrelin has, number one, anti-inflammatory properties. Second, it has regenerative properties. And number three, during stress, it prevents the cell death and apoptosis. So collectively, all these features may be very beneficial for the patients who are already in severe mucosal barrier dysfunction, inflammation, or in a critically ill patient lying in ICU setting. I thank you very much, and I thank Dr. Kangawa and Kojima for inviting me here. And now I would be happy to take your questions, if any. Thank you.